Let's say hello to Matt. Hey, Matt, you're on the air.
Hey, Docs. I'm 44 years old, and a couple days ago I was playing indoor soccer, and I felt like somebody kicked me in the back of the leg, but I turned around, nobody was there. Felt like a popping feeling or sound, and from listening to you guys, I knew what that was pretty much right away. It didn't hurt really bad. I limped off. I went to the ER and was diagnosed with Achilles tendon rupture. And they splinted me. And one thing that was interesting to me is they said that it was good that I got in right away, that maybe there was a chance of no surgery. So I was hoping you could talk about that. They said 9 months, no sports. And I was kind of curious about what are my chances of re-injury.
Yeah, so great question. So yeah, I think devil's in the details matters a little bit, where exactly the injury is. But this is one of those, academic versus real life decision. So academically, Dr. Cardone will tell you absolutely fine to treat this non-operatively as long as you get in a boot with heel wedges right away, and you start doing some gentle physical therapy, within a couple weeks, maybe have it in the boot for 2 weeks and then start moving it a little bit. And then, the results are very, very similar to operative treatment. My counterpoint to that would be, a young athletic guy with retraction, with tendon retraction, that if you think about it, the two ends of the Achilles, if they are separated by, let's say, a couple centimeters, there will be scar tissue that forms in between those two ends, but it will ultimately result in a relatively elongated tendon compared to what you normally had. So your ability to exert power with that leg will go down a little bit. Now, for recreational sports, it really might not matter, but it could. So there's a little bit of I would argue that if you treat it non-operatively, there's probably, and again, I would say every case is different. So I would have to examine you. I would have to look at an MRI, and I might think very differently about it depending on the exam and the imaging. But I do think for an active person where there is some retraction, restoring that, we call it the length tension relationship of the calf or the Achilles tendon, probably does matter. And there are very minimally invasive ways now of suturing the tendon, which in my opinion are almost tantamount to non-operative treatment, other than you're connecting both ends of the tendon a little bit more anatomically. So for me, the risk of things that were a problem with surgery before, like infection, has gone down significantly. And if you're planning on going back to sports that require explosiveness, I think it'd be very reasonable to still do surgery. But if you decided to do non-operative treatment, there's plenty of evidence that supports that as well.
You know what, and I would say, especially for a 44-year-old Matt, active like you are, I think, like Loma said, certainly when you look at the more recent evidence over the past decade, it does speak to non-operative treatment, especially in that 40 and older age group. But I really think, and Lomas may be surprised to hear this, even for especially young 40s, 40 to 50, it's really, here's where you really talk about shared decision making. It's really a sit-down conversation with the orthopedist. To really go through pros and cons, talk about everything, talk about your lifestyle, look at the evidence studies, look at your tendon, where the tear is, maybe how much retraction there is, get a feel from you where you're leaning towards. Most cases now, again, in the 40 and older group are done non-surgical, non-operative. But again, I think it's one of those things where, get all the information, get as educated as you can, and make the best decision for you and that shared decision making.
We basically just told you, we told you nothing. We said you could do it or you could not do it. I'm going to go on a limb here. I'm going to say if you're someone who likes to be in control of a situation, just get it fixed. I think the chance of a problem is low. Just make sure it's done by somebody who is, has experience doing it. And there are a couple of you can ask them about minimally invasive techniques. There are a couple of them that are out there where the incision is about, half to 3/4 of an inch. And you can pass the sutures, and the recovery is exactly the same. You don't, and the risk of infection is very low. So,
Matt, thanks so much for your calls.